Hi, everyone. Today I'm going to be talking about screening for disease and the different levels of prevention that epidemiologists use in order to reduce the risk of disease in the population. So the first thing I'm going to talk about is the levels of prevention. I'm not really going to be getting too much into primary and tertiary, but primary would include preventing the disease before it actually happens. And tertiary would be limiting disability and improving the quality of life of people with disease. I'm primarily going to be focusing on secondary prevention today because it has to do with screening for disease. So, like I said, it involves preventionary screenings for disease before the onset of symptoms. And an example of a secondary prevention test or screening would be blood pressure tests, an STD test, mammograms, and there are a multitude of other ones. So a question you might have is, what exactly is screening? A screening test is done on individuals who don't really seem to have any symptoms for disease. This is different than a diagnostic test because in a diagnostic test, people with disease or with symptoms of the disease are given it in order to confirm a diagnosis. So screening tests are used to reduce the risk of disease and encourage those with unhealthy lifestyles to change in order to, and potentially catch a disease early enough in order to treat it before symptoms and complications get really bad. Sometimes with a diagnostic test, symptoms and stuff like that may already be super bad, so they might not have a very good prognosis. So, like I said, a diagnostic test is done when a person shows symptoms of a disease and they are done to diagnose. A screening test is not done to diagnose. In order to diagnose a disease, you have to do a diagnostic test. And an example of this is a biopsy. So, for example, like I put in here, if someone is suspected to have breast cancer, they might do a biopsy on the area and take out a piece of the suspected tumor or whatever it may be. However, this is pretty invasive, and doctors and other healthcare providers don't really want to do this unless they absolutely have to. If there was a way to do this so it wasn't so invasive, of course, they're going to pick that first, and this would be kind of like the last option. But hopefully screening would have been done before that to prevent even the tumor growing to the size, to a larger size to affect the individual. So there are a couple types of screening. There is mass screening, which are large scale and population based. And this could be screening employees in a company to reduce insurance costs. So, for example, they would test employees in a company, they would test their blood pressure. And if most of them were within a normal range and they weren't seen as hypertensive or things like that, they might get a reduced deductible or reduced cost on their insurance, less they would have to pay each month. And selective screening would be testing those who are considered at risk for disease based on different variables. So that could be family history, it could be obesity, smoking, maybe someone who lives in the mountains, the Appalachian Mountains might get tested for something like lung cancer because of the amount of coal mining fumes that are in the area and the amount of cancer diagnoses that are given. So those are the two different types. So validity and reliability are pretty big parts of screening. Unfortunately, these two have an inverse relationship most of the time. If a test is reliable, it's usually not as valid. And if it's valid, it's usually not as reliable. So reliable is the ability for a test to yield a similar result despite who's performing it. So you could go to multiple different clinics and get the same test and it's going to yield the same result. If you're told you're hypertensive, if you're told you're hypertensive at one place, you should be told you're hypertensive at another place. And if you get a different result, it usually means that the test isn't very reliable. And the validity of a test would be being able to decipher who actually has the disease and who actually doesn't have the disease. So there are a few problems with screening tests, unfortunately. Of course, not all of these can be perfect. So like I said, they can lack validity and reliability, or even both. Some people may be diagnosed with the disease even if they don't have it. And this would be due to lack of specificity. And on the other hand, someone may not be diagnosed even if they do have the disease, which would be due to lack of sensitivity. This is pretty unfortunate because obviously you don't want to get a false positive and you don't want to get a false negative either. And you want a test that is going to be able to tell you every single time if you for sure do have a disease or if you for sure don't. And that's definitely something that, epidemiologists and healthcare providers are working on. They're working to improve these tests and make them more reliable and valid, of course, because we don't want to be scaring people. And so I just want to give you all a few more examples of screening types, because chances are you guys have probably had them before and you're going to be like, oh my gosh, whoa, that's crazy. I didn't even know that was a screening test and not a diagnostic test. So a mammogram is the first one, and they're usually done for women over the age of 50, unless you have a family history or you may have suspected something in your breast. And this is a preventative screening test for breast cancer, and it's done usually every few years. Another is a colonoscopy, and this is going to be testing for colon cancer and other different like lower GI issues. And they're both done in both men and women. This test is really important because colon cancer is actually the third most deadly cancer in men and women. So it's important to be regular. And if you notice any irregularities, to go get a colonoscopy done. It's super important, and to catch these things early before they get worse. And the last one I'm going to talk about is a Pap smear. So this is done for women over the age of 21 or if they are sexually active. Again, same thing. If you suspect something, you may get a Pap smear earlier. And this screens for cervical cancer. And cervical cancer is usually caused by HPV. This test it's not very invasive. So that's always a good thing too, of course, because we want to not do an invasive test if we don't have to. Perfect. And that is all I have for today. Thank you guys so much for watching. And just remember that it's super important to make sure you're up to date on all of your screening tests. And if you ever notice anything that is a little bit abnormal, to go get that checked out, because it's really important to catch things early. That way you have a better prognosis, and that you don't have increased time of symptoms. Thank you guys so much.